So, Dr. Mora, at the outset, you had the opportunity to tour FastCap, and you had the chance to kind of see a lean factory in action. The first thing, what were your impressions? I'm curious.
Well, it was helpful for us because we were very early in our journey, and we still are, to move from theoretical discussions around lean to really a very concrete example of how lean was being used in your facility.
Okay, and so right out the gate, what are the transferables? Is there anything that healthcare providers can learn from going to a well-run lean factory?
Well, there are a couple of things that I think I took away. One was how you modeled the go-see process, how you modeled spending time in the workplace, how you modeled the investments that you're making in people. We spent time in your huddle. I saw the relationships that you established in the team, saw the development you did, the education you did with the team, and also the engagement of all the staff. I've talked a little bit in other settings about how the problems that we face at Group Health and in healthcare in general are very complex problems.
Right.
If there were one or two or three simple solutions, I think we would have found them. What there are 1,000 little problems that we all need to be working on. And what we saw was how you use your staff, which I think is where we want to go and are going as a healthcare system. How do we use all of our staff, the thousands of our staff, to solve the problems? Does that make sense?
Absolutely, and specifically how to solve those little small problems, which hopefully will amount to something significant. So rather than, I got the impression a little bit, you realize, or your takeaway was, we're not going out and trying to save the world, we're trying to figure out what are all the small little gains we can make on a daily basis?
Yeah, that's a good summary. So I saw continuous improvement. Mm-hmm. I saw the pursuit of waste and waste reduction. And I saw a very focus, or a very, I saw a group and a team which is very focused on processes and flow. And I think you're right, by addressing those 1,000 little problems in aggregate, that adds up to big improvements in the factory, and I think that's where we're headed as an organization.
So the question is, when you walked away from the tour, was there one thing, if you could wave a magic wand, if there was one thing that you would want to implement as quickly as possible, what was the takeaway from the factory floor to the healthcare floor? What would that look like? Anything particular?
The respect for people and the focus on continuous improvement. And sorry, my phone just went.
No problem. So what does that look like, though? What does respect for people look like? It's easy to say that. What would it look like in your venue?
So in our venue with 10,000 employees at Group Health, as I mentioned previously, there are thousands of little problems and little opportunities for improvement. By engaging all the frontline staff, by involving them in cross-functional improvement work, that's how we're going to get to those 1,000 little problems. That's how we're going to solve the challenges that we face.
And the hard thing is, how are you going to engage them? Is there mechanics that you're going to set up, or that you've already set up to try to garner all that creativity?
Yes. So we've, as I've said, just begun our journey, and we still have a long ways to go. But involving frontline staff in the design of improvements, making investments in the training of staff so they understand the approaches and some of the tools that we use, and really modeling the respect for people and the importance of continuous improvement in very concrete ways by involving them in the improvement work and in designing the improvement work.
And do you do that on a daily basis, a weekly basis, through Kaizen events? How are you implementing that?
I think we're doing all of those. We're doing those through formalized improvements events. We're doing those through setting up our management system to have teams focus on the work in front of them today around improving the service or the quality experience for our patients. And we do them in more formal strategic planning venues as well.
Excellent. And so curious, when you came here, was it a shot in the arm where you went back and you said, okay, now we're empowered to go move to the next level? Was it just another event in the process of learning lean? How did the whole experience play into touring a factory floor that's so engrossed in lean as we are? Was it just an event, or did it move you to a new trajectory, if you will?
Well, I think it was a little more than just an event. It was, and it was part of our journey that we've been on. We still are early in our journey. We still face some significant challenges. I think some of our hardest challenges are yet ahead. But it was an important event for us to come together as a team, to see the work that you've done at the factory, and for us to then begin to move from theoretical conversations about how we might translate that into our healthcare environment to real concrete examples of what we can do. I think that the term I've heard used is, how do we begin to act our way into new ways of thinking that helped us make that transition?
Yeah, I think it was you that came up with this concept. I can't recall, but I walked away with something from your visit to our factory that really changed my whole way of thinking. I mean, it was pivotal. I went to a different trajectory, if you will, because I understood something I never understood before, and that is, we take all this creativity from people and they make all the improvements every day. And I believe it was you that made the comment that when we don't take that creativity from people, that is wasted inventory of creativity. We take all that creativity and we never really act on it. We brainstorm, but we never do anything with it. And that in and of itself is like wasted inventory sitting on the shelf. Do you remember that? Was that you that said that?
It was one of my colleagues, but it was our team that had that discussion.